Good day, sir. I am Ira Lopez of BSN 13, and now I will perform the return demonstration for the procedure of administering nasal medication. The purpose is for astringent effect or to shrink swollen mucous membrane, to loosen secretion and facilitate drainage, also to treat infection of the nasal cavity or sinuses. So the most commonly used are nasal decongestant. And for the assessment, we have to assess for the following such as the client's level of consciousness and ability to understand instructions, the client's vital signs, the presence for nasal discharges, nasal irritation, and nasal congestion. For the medication, we have to assess the intactness, also for the expiration date and color and appearance. So now with the planning, we have to observe the 12 rights on giving medication such as the right client, right drug, right dose, right route, right time, right documentation, right assessment, right evaluation, right drug presentation, right motivation and approach, right to refuse, and right of the client to know the reason of the drug to be administered. And then we also have to perform hand washing before and after the preparation. For the materials, we have to prepare the following such as the hypo tray with lining, the prescribed nasal medication, the medication card, 2 pieces of sterile gauze, and a garbage bag. So now, for the implementation or the procedure, so first we have to perform hand hygiene and put on PPE if indicated. And then we have to identify our client, introduce ourselves, and explain to the client or relative the procedure as well as the action of the medication. Because this process will ensure that we are giving the right medication to the right client. Ma'am, ano pong pangalan niyo at birthday?
Diana Lopez, September 27.
Thank you po, ma'am. So, ngayon po, ibibigay ko po sa inyo yung gamot po para po sa ilong po ninyo. Okay po? Para po maginhawaan din kayo kung may pagbabaraman po sa ilong natin. Okay po, ma'am? Thank you po. So now, place the hypo tray on the bedside table and then provide client safety, privacy, and comfort. So we have important reminders upon providing those, such as proper positioning. Based on the procedure, it can be sitting, supine, supine. And also to put down the side rail on the side that we will work on while keeping the other side rail up. Also by spreading the curtain or closing the door during and after the procedure. Also by placing the call light within the client's reach. So now, we will pull down the side rail on the side that we will work and assist our client in a supine or sitting position. And then we will put on clean gloves. Ma'am, okay na po ba kayo sa pwesto po ninyo?
Okay na.
Okay po, ma'am. So after that, offer a client a gauze to blow her nose and then dispose the gauze into the garbage bag. So ma'am, pa-blow na lang po nung nose po ninyo. Singa lang po. Palagay na lang po sa garbage bag, ma'am. Thank you po. And then now, so assuming a supine position with the head tilted back. Ma'am, ayos lang po natin ng ulo. And then after that, hold the medication just inside the nares and then have the client inhale as the spray enters the nasal passageway. So, for our children, we do this process in an upright position to prevent the excess spray from being swallowed. So, ma'am, papress lang po ng isang butas ng ilong. Tapos po, kapag ini-spray ko na po, hinga lang po tayo, okay? So po, ma'am, 1, 2, 3. Kabila naman po, ma'am. Ayos po ang ulo. Okay po, 1, 2, 3. Okay po, ma'am. Thank you. So, after that, we will now assist our client into a comfortable position with raised side rails. So, ma'am, okay po ba kayo sa position nyo ngayon? Thank you po. And then, dispose all used materials properly and rearrange the reusable ones. And also remove gloves and PPE if used and perform hand hygiene. Then after that, assess for the effectiveness of the medication given and document the administration of medication into the client's chart immediately, including the client's reaction to the medication after administration. And then lastly, evaluate for the client's reaction to the medication within appropriate time frame.